in.
Hi, my name is Alyssa. I'm going to be your nurse today. I'm going to go ahead and wash my hands real quick, and I'm going to go back and explain to you what we're going to be doing.
Okay.
I'm going to pull this curtain for some privacy. I've already done your vital signs, okay? Can you tell me your name, please?
Courtney Van Dam.
All right, and can I see your wristband? All right, and what is your date of birth?
7/16/90.
Okay, and can you tell me where we are right now?
The hospital.
All right, and what year is it?
2019.
Okay, patient appears to be alert and oriented ×3. Posture is straight. Hygiene is adequate. Patient appears clean. No visible deformities. Speech and dress are appropriate for date and time. All right, I'm going to be doing a head-to-toe assessment on you today, so I'm going to have to touch you at some point. And if you need anything in the meantime, you just let me know, okay? So I'm going to start by looking at your head. Okay, no deformities, no lesions, no parasites. And I'm going to go ahead and touch your face a little bit, okay? If you could close your eyes for me. And when I touch you, you just tell me what part of your body I'm touching.
Forehead. Cheek. Cheek. Chin. Nose.
Great. Go ahead and open your eyes back up. And can you just raise your eyebrows for me? Go ahead and smile. Puff your cheeks out. Okay, stick your tongue out. Good. Up, down. All right. And go ahead and push against my face. Your face against my hand. There you go. And on this side. Good. All right. Cranial nerves 5 and 7 are intact. Next thing I'm going to do is I'm going to look at your eyes. Okay, I can see now that your eyes are round. Pupils appear to be about 3 millimeters. And there's no discharge, no redness. I'm going to go ahead and have you look straight at this wall here. I'm going to shine this light into your eyes. Pupils are equal and reactive to light. And go ahead and keep looking at that wall. And then look at my pen here. And they react to accommodation also. Good. That's cranial nerves 2, 3, and 4, and 6. All right, and go ahead and cover the same side of your eye that I am. I'm going to test your peripheral vision, okay? So when you see my fingers coming down, you just let me know.
I can see them.
Okay,
I can see them.
good.
I can see them.
And go ahead and flip to the other side for me. Same thing.
I can see them.
All right,
I can see them. I can see them.
good. All right, so cranial nerve 6 is intact. And I'm going to go ahead and take a look at your ears. Canals are straight, no excess cerumen in the ears. Go ahead and close your eyes for me and tell me which ear you can hear me out of.
Left. Right.
Good. Cranial nerve 8 is intact. Go ahead and hold one side of your nose and sniff for me, and the other. All right, go ahead and put your head back for me. I'm going to look in your nose here. Septum is straight. Doesn't appear to be any deformities. And that's cranial nerve 1 is intact. And next thing I want you to do is just go ahead and stick your tongue out for me. Say ah. Good. Tonsils appear to be +2. Uvula is midline. Tongue is midline. Pink and moist. Dentition is good. That's cranial nerves 9, 10, and 12 are intact. And the next thing I'm going to have you do is just raise your shoulders for me. Good. Put them back down. Go ahead and push against this hand and this hand. And then turn your head from side to side, up and down. Good. Cranial nerve 11 is intact. Next thing I'm going to do is just go ahead and check your lymph nodes. All right. Preauricular, postauricular, tonsillar, submandibular, submental, and anterior cervical, posterior cervical, occipital, and go ahead and shrug your shoulders up for me, a little bit down, there we go, and supraclavicular. No enlargement noted in any of the lymph nodes. Good. Next thing I want you to do is just go ahead and raise your arms for me. Good. Bring them in front, back, behind you. Hug yourself here. Go ahead and move your wrists and your fingers. Turn your head from side to side, up and down. Good. Go ahead and raise your legs up straight for me. And move your ankles and your toes. Bend them back down. Range of motion is even. Doesn't appear to be any difficulties with that. The next thing I'm going to do is I'm going to go ahead and listen to your back. If you would go ahead and turn around for me, I'm going to listen to your lungs. All right. Doesn't appear to be any labored breathing. I don't see a cough at all. Respiration rate is even. Depth is moderate. Doesn't appear to need any use of accessory muscles when she breathes. I'm going to go ahead and look at your spine. Spine is straight, no deformities, or doesn't look like she has any issues with scoliosis. I'm going to go ahead and have you say 99 for me.
99.
And again.
99.
And again.
99.
Doesn't appear to be suffering from tactile firmitis. Next, I'm going to check the thoracic expansion. Just breathe in and out for me. Good. All right, and I'm going to test for some kidney pressure also. If you tell me if you have any tenderness here.
No. No.
Good. Next thing I'm going to do is just take a listen to your lungs. Every time you feel my stethoscope move, if you could just take a deep breath in and out. Okay, good. I don't hear any crackles. I don't hear any wheezing. Don't appear to have a cough. I'm also going to check right here under your arm. Just lift your arm up for me. Take a deep breath in and out. And again. Good. And on this side. And again. Good. Chest appears to be AP lateral 1 to 2. Go ahead and turn around for me, back to the front. All right, I'm going to listen to your lungs from this spot also. Deep breath in. Breath sounds are clear and even. All right, the next thing I'm going to do is I'm just going to check for your pulses. Go ahead and hold your arms out for me. We'll start with the radial pulse. Radial pulse is +3 and brachial. Brachial pulse is +2. Go ahead and do your carotid. +2 on the carotid pulse. Good. The next thing I'm going to do is go ahead and take a listen to your heart and also to your carotid artery. Good. It doesn't appear to have any signs of Brug's. And I'm going to take a listen to your heart. Second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. Fifth intercostal space, left mid-clavicular line, Mitral. Heart sounds sound even. No appearance of a murmur. Good. All right, and the next thing I'm gonna have you do is go ahead and put your arms up in front of me, push against me, and then try to resist. Good. And your thighs push against me. Push against me here. Good. And then open here and try to push against me. Good. All right, the next thing I'm gonna have you do is go ahead and turn, lay down. I'm gonna listen to your bowel sounds. Abdomen appears flat, symmetric. Go ahead and take a listen here. Hyperactive bowel sounds on the left side. I'm going to go ahead and palpate, okay? And you just let me know if you're having any tenderness. Good, I'm going to go a little bit deeper. Just let me know if you're having any tenderness.
No.
Good, when was your last bowel movement?
Today around 3 p.m.
All right, and were you having any difficulties with that?
No.
And when is the last time you urinated?
About 10 minutes ago.
Great, any hesitancy, frequency, burning, pain, irritation, anything like that?
No.
Good. Okay, I'm going to finish checking the rest of your pulses, okay? I'm going to do the popliteal, +2 pulse on the popliteal, and I'm going to do the posterior tibial, +1 on the posterior tibial, and the dorsal pedalis, +2 on that. All right, I'm going to go ahead and test your plantar reflex while I'm here. Are you ticklish on your feet?
No.
Okay. All right, I'm also going to test for some ankle clonus. So if you could just push against my hand and against my hand here. Good. Against. Good. Looking at your skin, I don't appear to see any deformities, no lesions, tumors. Skin is warm. Temperature is warm. And let's see. Capillary refill. 2 to 3 seconds. 2 to 3 seconds. I don't see any appearance of any edema. All right, go ahead and sit back up for me. And I'm just going to test the rest of your reflexes. I'm going to start with your biceps, so just let your arm hang like that. All right, turn over here. We're going to do your tricep and your brachioradialis. And over here, just let it hang. Bicep, tricep, and your brachioradialis. Okay. And I'm also going to do your your patellar reflex. Good. And your Achilles. Good. The last thing that I want you to do for me is just go ahead and stand up. And I want to check your gait, so go ahead and walk forward, turn around and walk back. Gait appears to be even. No difficulties walking, no use of an accessory device. Go ahead and close your eyes for me and try not to let me push you over. Okay? Good. Good. Pass the Romberg test. Okay, go ahead and sit down for me. And is there anything I can do for you while I'm still in here?
No.
All right, I'm going to leave your call bell where you can reach it, and I'm going to go wash my hands and document my findings, okay?
Okay, thank you.
Thank you.